So, good morning to you all. Thank you for the opportunity to present our study titled Online Sexual Health Information Seeking, Digital Literacy and Risk Behaviors Among Brazilian University Students, a cross-sectional study. My name is Germano Couto. I'm from Fernando Pessoa School of Health in the city of Porto, Portugal, and I led a team of 4 researchers from Portugal and Brazil to this study. Social media are now the main source of sexual and mental health information for young adults. They reduce access barriers, but exposure users to misinformation and uneven content quality. Brazilian university students are highly connected and turn to digital platforms for health topics, making them an ideal group to study these dynamics. Our objective was to analyze how exposure to digital sexual and mental health content influences knowledge, attitudes, and behaviors among young adult Brazilian college students. We examine links between online information seeking, digital health literacy, problematic social media use, and risky sexual behaviors. We conducted a cross-sectional online survey in September 2025 with Brazilian university students aged 18 to 30 years old. Final sample, 65 participants recruited via student social media channels using convenience and snowball sampling. Data collection was voluntary, anonymous, through a secure online platform. We use validate Brazilian Portuguese instruments as EILS for digital health literacy, MHLQ for mental health literacy, SMDS for problematic social media use, DAS-21 for depression, anxiety, stress symptoms, and YRBS for risky sexual behaviors like condom use, patterns, substance use during sex. Sociodemographic data show that participants' mean age was 22.5 years, 22 and a half years, mostly cisgender women, 63%, and heterosexual, 57%. Racial breakdown, white 58%, brown 28%, and black 12%. Mainly nursing students, 60% from public institutions living with family. Results show that most students had searched for sexual information online, but this was not associated with safer sexual practice. 62% of sexuality activity participants reported one or more risky behaviors, regardless online searching. Digital exposure doesn't guarantee safer behaviors. Online sexual information seekers scored slightly higher on EILS, digital literacy, but not significant. Perceived ability to evaluate online health info, also unrelated to sexual risk. Digital literacy alone doesn't predict safer practice in this sample. Age and sexual minority status were the strongest predictors of risk. Older students, higher odds of risky behaviors, and sexual minorities, 2 times higher risk. Online seeking became non-significant after sociodemographic adjustment. Problematical social media use not linked to sexual risk, but strongly associated with depression, anxiety, and stress. Problematic use marks psychological stress, not direct sexual risk. Results suggest that online sexual information seeking and digital literacy don't clearly protect against risk behaviors. Age and sexual minority status drive sexual risk more than digital factors. Problematical social media use signals mental health vulnerability, not sexual risk. Digital health strategies need social demographic tailoring. We should not assume online information equals to safer sex. Target older students and sexual minorities. Monitor problematical social media use, a mental health and red flag. Future research is needed with larger samples, mixed methods, credibility appraisal studies. So thank you for your attention, and now I'm available for any question you have.